Well, first of all, we're glad we got involved, and we want to thank the Change Foundation and the Innovation Cell for helping us out on this. So, and that's why we got involved, because we thought we needed help. So we're glad we did. And the reason we needed help is we had a very small presence, you could say social media presence, on our main website, on our corporate site, camh.net. And it's been growing a little bit. But over the past year or so, more doctors have approached us, or we found out about the odd doctor using social media to contact their clients, and clients have been asking us, patients have been asking us. So we thought it was time to really explore where we're at with this and see what assistance we needed to develop a strategy and push forward with it. We already feel that we've had quite a profound learning from this experience. And that learning is twofold. It's one, what's the real essence of social media? And what we've seen the answer to that is that it's a very powerful communication tool. And, or as you say on your site, and we've learned, a conversation tool more than a communication tool. So that was a powerful learning, because naturally in mental health and addictions, the conversation is very important. So that's number one. And the second area was that the broader definition of social media is really important to us, because it kind of validated some directions we'd been thinking of going in and with new technology. And how we could integrate social media into some of our online presence and clinical tools and so on. We're creating this hub, so to speak, or a center for knowledge and innovation around the use of new technology. So let me give you an example. It's not really our example, but in the UK, and I believe there may be one in the US, some people have developed clinical tools in mental health and addictions, such as self-management tools to help patients manage their illness. So it might be, there is one fairly well-known tool called a daily mood diary. And that's done through either a mobile application or online through internet. What we see now is that there's a great possibility for not only that kind of clinical tool assisting the clinician and the patient, but merging that or integrating that with new conversation methods. Because, you know, quite honestly, I was talking to my friend the other day, and her daughter says she only uses social media now to communicate. So, especially in treating younger people, we see a really positive steps we can take to integrate the use of social media into clinical tools. So more specifically at CAMH, there's a couple areas. I mentioned knowledge exchange. So we have a portal for transferring knowledge to professionals and allied professionals, social workers, nurses, doctors, and so on. And other people, say, for example, armed forces who deal with mental health and addictions, and police forces and so on, police services. And so that knowledge translation site, which is up and running now, and we're investing more into it, it's our knowledge exchange portal, that has the capability for quite well-developed use of social media, from whether it's Facebook, Twitter, and the typical things we all know about, or microblogging and chat rooms and wikis. So it has all those tools available to it, but we haven't fully developed them. So that's one definite area we're going to move in terms of the knowledge exchange and translation. And in terms of the clinical tools I already mentioned, there's some specific kind of micro tools we can look at developing and integrating. But we're also in the early stages of implementing a new client information system at CAMH, which is basically our e-health system. And so we see great possibility for integrating some tools, of course under privacy considerations, with privacy considerations. We see some great opportunities for integrating social media tools into that. In terms of our mentors, we look wherever we can. We recognize we're a little bit babes in the woods, and we look wherever we can. One thing we do look is we look for people who are carrying out projects where they've already done the evaluation. So as much as possible, of course, like any other hospital, we're going to look for things which are already close to being proven as a best practice and then adopting those. And our patients are our mentors, and even on our Knowledge Exchange portal, we will have a site which I think we're tentatively called our Patient Voices. And that will be to assist the clinicians by having a place they can go to for that interaction with the clients. Some of the social media tools we're talking about today, today they're similar to maybe where email was 20 or 30 years ago as a communication tool. Now, when we talk about email, it's certainly my primary means of communication. So I can certainly see how other forms of communication could supplant email. There are some studies on some social media tools already done, and not only in terms of improving the quality of care for a particular patient and the interaction with the clinician, but the initial studies show particular tools being very valuable in reducing the time spent, which is saving stress on the system, and at the same time improving the quality of the exchange, less misunderstanding and more direct communication, and more just in time, to use an expression from the manufacturing sector, but that just-in-time connection is really important in mental health and addictions. And that's another way where we can try to get closer to that goal. I think the methodology of site partners that you used initially, and CAMH was happy to be one of them, was quite effective, and maybe some of the next steps could be around project partners for select 2 or 3 or really key projects that integrate social media into healthcare, and go with those and try to grow on that.